In check, everything we do in check is strategic. We are committed. Our vision in check is to create a healthier world, and we are committed. And one of the things we saw and we know is that local government is very, very essential to reaching out to the communities. Chairman was so impressed with what we did. He came to visit us at the hotel because we were leaving the next morning and appreciated us. In fact, he gave us a fat envelope. Let me stop there. No asking what is there, but it was impressive. By God's grace, next week we're going to be at Lekki Etios and local government, and the local government has been very, very supportive. So, because the local government is closer to the people, and local government is in charge of primary health care, which covers more than 80% of the needs of the people. So what we're having this morning is want to listen to how can we break the barrier to healthcare, innovation and access through the local government or through local governance. And I want us to listen to this very practically because we are going to be applying the lessons that we're going to learn from today. So join me to welcome the representative of the local government. I'm sorry I can't see your name, sir. The local government chairman of Ogbomoso South Local Government. You're welcome.
Good morning, everyone. My name is MC Atanda, MBBS. The chairman is unavoidably absent, and being a friend, he called me some days ago to inform me about this program. I had to come around. Maybe he felt since his health, I should come. Now, before I go ahead to do anything, I have to respect and honor and acknowledge the presence of my teacher, Professor Oyeniyi. Welcome, sir. Thank you. Well, the chairman he gave me an address that I have prepared, and probably I'll have to read it. But when I look at it, it should just be like an interactive section. But I didn't prepare for that because he gave me something and I'm going to read it out. And if there's any need for me to lend my voice, as the program goes on, I'm going to do that. So I think they have also distributed the copies of this address. I told the chairman, I said, most of the things I'm going to talk about today will revolve around KBC. Because the topic says breaking barriers to health innovation and access. Honestly, I know KBC will be surprised with some sort of things I'm going to say, but he's, in his own way, as a traditional ruler, he has tried so much at breaking barriers to health access in our hospital at Ogbomoso. There were so many things to the glory of that KBC had facilitated in the hospital, helping out reducing the stress for our patients, the indigent ones. Before I got to the hospital, they used to have, when they started Lancet Teaching Hospital, that was where the state hospital was. So they didn't have enough space where they moved them to. So it's not a very small hospital like that, where they have to just get all the departments out of the small space that they have. But the KBC was able to connect some people, and they built a state-of-the-art maternity center for the hospital. And when you get there, it has the postnatal ward, the antenatal ward, the labor ward, the theater, and the gynae ward. Now, what it means is, a lot of people, just like in Ibadan, once they tell you go to UCH, a lot of people get scared. You understand? Because that's a tertiary scanning, Orita Mefa. But you see, that's a secondary facility, and it's what KBC was able to do was able to assist people in terms of the number of people that should go to Lautech. We have to come to us because we have the space. There was a time KBC facilitated an X-ray machine to the hospital. This is not from government, not from your state government. It did access for patients. So, but before I say another thing, let me go into the address that the chairman gave me, a keynote address prepared by Honorable Oyedotun, the executive chairman of Ogbomoso local government, Ogbomoso, on the topic breaking barriers to healthcare access and innovation, and the urgent need for more funds. This occasion is channeled to shine spotlight on the local government effort to sustain and consolidate unspirited commitment geared towards healthcare delivery, infrastructure, staffing, motivation, and replenishment of drugs and dressings. On this note, today's session should be regarded as an entity of its own, rather as an underlying necessity in the healthcare delivery services of any developing nation like ours, most especially in a federation practicing multi-tiers federal, state, and local governments. According to the World Malaria Report 2015-2016, there were 212 million new cases of malaria and 429,000 deaths. One child dies from malaria every 2 minutes. Nevertheless, the message is that this generation can end malaria, one of the oldest and deadliest in human history. More importantly, this interactive session presents an avenue to highlight the need for continued investment and sustained political commitment for disease prevention and control. Since 2000, malaria prevention has played an important role in reducing cases of deaths, primarily through scale-up of insecticide-treated nets and indoor spraying of insecticides. On the innovation through local government, I would like to explore the quote of a futurist and philosopher, Alvin Toffler, which says thus: illiterates of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. What this implies is that the domain of health sector has changed, and we continue to witness more dynamic and critical changes as the world navigates technology-driven 21st century. The ultimate outcome of the trend is this: new jobs, new posts will also emerge, and novel health challenges will manifest. But only those who are rightly prepared and exposed will benefit from the revolution. More than ever before, we have resolved to revamp our entire health, social, economic, and political sectors as dividends of good governance are excellence. Once again, I reiterate that this encounter shows how bringing to bear honest dialogue to help us see the truth from all perspectives. That which is true is one, that which is right could be many. From my experience and exposure in democratic experiment, local government is a barometer in the health institutional sector. Traditional institution, by implication, the Council of Chiefs of any community, is vested with the responsibility for development, leadership, and promoting government policies, projects, programs, and other related matters. Chieftaincy titles is the affirmation of honor bestowed on illustrious sons and daughters of a community that have made various sterling contributions towards the development of their community. Human communities without effective and accessible healthcare is an accident waiting to happen. In the same vein, continuing innovation such as solar-powered supply of energy, cold chain standardization, robotics, and artificial intelligence have potential for strengthening healthcare at the grassroots. The collective and unwavering political will on the part of His Excellency, Engineer Seyi Makinde, the Executive Governor of Oyo State, and the willingness to key into the system by Haugon, Association of Local Government of Nigeria, in according priority
to accessible healthcare service delivery, Oyo State Health Insurance Agency, monthly grants for procurement of drugs and consumables for all health centers, and establishment of primary healthcare board for recruitment, promotion, training and retraining of medical and non-core medical staff serve as positive indicator and underscore how important local government is in the scheme of things. Then, it is of great concern to note that the great monsters of the mind are far more than those that actually exist. Fear, doubt, and hate have hamstrung more people than the beast elephant. Now, to breaking barriers to health access. What is the function of local government? What is the constitutional process I sought to uphold? Then the importance of political power to the people and establishment. Local government is just means to an end. The end itself is service to the people's interests. It is really inspiring to be around people. The relevance and importance of the issue under discourse is something I want to support. Now, for those who will question the meaning of barrier, I would like to state for the records that for all intents and purposes, breaking barriers in this context means effective and efficient healthcare services accessible to the people of all status, religions, creed, and ethnicity. Yes, custom, tradition, and practices of a group can constitute barrier. An instructive case is campaign on elimination of female genital mutilation. The immediate and the long-term implications. The timely factor of the theme is to scale up our policies and commitments at local government level to ensure that welfare, well-being, and wellness of all are adequately taken care of. No nation solves its fundamental challenges without allowing itself to be open-minded about preferred solutions. Each time we shoot down preferred solutions to our problems, we lose the chance to take a step forward. As it were, we gather here to sacrifice our decision at boosting health responsibility of the local government management and complement the effort of the stakeholders towards the realization of health delivery at the grassroots. Health is wealth, and a healthy mind in a healthy body translates to a highly motivated and productively wealthy individuals. There is always sowing before reaping. Indeed, the health of our local government does not require vitamins. It requires pragmatic administrators equipped with the intellectual detachment who put the local government first, not in words, but in words and deeds. Yeah, political dynamic changes. The more breaking of barriers recorded, the more the political dynamics tilts to the people's favor and career of the chairman. There is a world of difference between being an executive chairman and being a great, accomplished executive chairman. At this juncture, spiritual intervention from Supreme Being to heal the nation of our myriads of challenges and security of lives and properties, to guarantee rights to freedom of movement, especially in the discharge of duties. Others are cleanliness, recreational exercise, restraining from hazardous or life-threatening occupation, making peace with all manners of people you come in contact with, most especially good neighborliness, sensitivity to vigilance, and surveillance. Then all other things shall be added. Above all, Nigerians should be commended for our resilience. In other words, the goal is to bring the local government to global standard and best practices with global trend to assessment. Without intending to disrespect others, I make bold to say that Medicare is the lifeblood, or to be more accurate or precise, it is the pulsating heart of the community. Now, of interest is the illegal health facilities, of which many of them have become channels for doubtful quality, safety, and efficacy to the public in dispensing of drugs and treatment failure. Now, it is said that some deaths are not natural, even when they clinically look so, when they are clinically so. The government of Oyo State has resolved to ensure that citizens have their fair share of government patronage. Therefore, all the beneficiaries have to do is to be responsible, obedient, and law-abiding, particularly the youth, because they are those that have the energy, the vigor, and the enthusiasm to get things done. Kindness has no choice, peace has no religion, passion has no temple, and love has no borders. The commitment of local government are in the public domain, and I am mindful of the beneficiaries who felt perpetually connected to the tradition of primary health care service. The true test of local government may not necessarily be in the large volume of resources at its disposal, but in the astute management of the available resources, especially at this critical period in the history of the world when they are not enough. Indeed, today's occasion is founded upon a principled commitment for public good and sustenance of accessible healthcare in the pursuit of good governance. True friends are like stars. You can only recognize them when it's dark around you. I suggest more innovation in local production, for no nation grows without the citizens being actively engaged in local production of goods, instead of over-reliance on massive importation and capital flights. More so, with collaboration from professionals, the pharmaceuticals need to ensure medicines remain safe, effective, and of good quality as they transit from one level of the distribution chain to another until they finally get to the patient and others in the local government as end users. We make it our business to inform, educate, and keep the people connected in servant leadership and fellowship, lest personal frustration metamorphosed into depression. In conclusion, I am indebted to the organizers or the facilitators for your intervention. Your concern has been invaluable, and it's only fitting and proper for you to see what we do and experience our process in the local government area. It does not take rocket science to know that securing the proper initial development of healthcare system rather than always seeking to reach new tricks to old doors. Stakeholders would need to set the right priorities and stick to them. Long live Federal Republic of Nigeria, long live Peseta State, long live Ogbomoso. So that is what I have. So before I go back to my seat, if I need to lend my voice into this from the government perspective, like breaking barriers to health innovation and access, I took my time to look at some points from the government perspective, what I think the government can do to break barriers. Yes, we talk about infrastructures and stuff like that, but innovation, I believe if government can put up policies and programs that would help health workers to update their knowledge, I don't think it's out of place if government can do such that. If there are new innovations in advanced countries, in advanced places where we have advanced healthcare, people can go for like attachment programs like a year on the expense of government. Now, will it be possible for me to put my hand in my pocket and get to go out of the country to go and learn something? Or when I come back, you want me to do that thing in my country without any added incentive. So I think government should look at that. It's very key. If people that are close to government can let them know, try and encourage your health workers, train them. It's not necessary, it's not this local training alone. Once there's any new thing out there, encourage them, give them funds, let them go and learn. When they come back, they're going to step it down to people around. Then number two, the issue of infrastructure is very key. Now in the rural setting, we need good infrastructure, most especially roads. Linkage roads between community to community sometimes can be very challenging. So it becomes a problem for them to move from one, even if they have very serious, like somebody needs an emergency, like an emergency civilian, and it needs to. The only place where you can do it is maybe some kilometers away. The roads seem not to be good. Somewhere that maybe something you should cover in 5 minutes, you are there in 25 years still struggling. So the life of that mother and the child, your mother child, be in danger. Then number three, security. When you go to the northeast now, it's a big problem because people seem so scared to travel. If you have to move from one point to the other, you could be kidnapped. There are bandits everywhere, terrorists everywhere. So if the country needs to be secured, because if you want to break barriers, because now a lot of people are dying silently in the corners of their rooms in those places, and they are now giving more food to all these quacks, patent medicine sellers who have turned themselves to doctors overnight. Then lastly, you see, in the local government sector, I want to tell Baba, sir, in the local government sector, we have so many health workers that are just there redundant, doing nothing. There's health promotion and education. I think they should have a timetable. That's on the part of the local government. There should be a timetable. You should go into the interns and educate them on necessary things they need to know and the importance of accessing standard healthcare. This is from the perspective of government. I wish I was invited as a small doctor to come and talk about something like so would have, but at least I'm talking as government. So thank you for listening.